How the roles of the family can help in addiction recovery. Addiction can take a toll on any family. When a loved one is struggling with addiction, it can affect every member of the family in some way. But there is hope, and it starts with understanding what addiction really is. Addiction is not just about drugs or alcohol, but also includes other behaviors that may be harmful to oneself or others. Addictions are unhealthy attachments to something outside oneself for relief from pain and suffering or escape from reality. Families play an important role in helping their loved ones recover by providing support and love while being honest and open without judgment as they learn more about addiction themselves. What are the important roles of the family in addiction recovery? Provide support and encouragement. Offering words of encouragement and support can help the individual feel loved and supported. Providing practical assistance. There may be times when your loved one needs help with basic tasks such as grocery shopping or cooking dinner. Offer to help out whenever you can to make the recovery process a little bit easier. Create a supportive environment. This means that the family should avoid yelling, arguing, and shaming their loved one who is in recovery. Instead, the family should try to create a positive and supportive atmosphere where the individual in recovery can feel safe and comfortable. Set boundaries. Families can help their loved ones in addiction recovery by setting boundaries. This includes things like setting rules about drug and alcohol use and limiting contact with people who are not supportive of recovery. Promoting healthy habits such as exercise and a healthy diet within the family can help set a good example for the individual in recovery. Families can also help their loved ones find healthy outlets for stress and anger such as meditation. Relapse prevention. One of the most important things that families can do to help their loved ones in addiction recovery is to help them prevent relapse. This includes things like keeping communication open, being supportive but honest, and helping the individual develop a support network outside of the family. Tips for talking about addiction with your loved one. It's not easy talking to your loved one about addiction. You may feel angry, hurt, and frustrated with their behaviors that you believe are destructive. But if you want them to get help for the addiction, then this is going to be a necessary step in the process. It can be tempting to avoid the topic of drugs or alcohol altogether, but it's important that you have an open dialogue with your loved ones about these issues because they need all the support they can get from people who love them unconditionally. It also helps increase their willingness for change as well as improve their chance of success after treatment by creating a supportive environment at home. Even though this process will take time and patience on both ends, it will benefit both of you in the long run. Here are some tips that might help make this conversation a little bit easier. Try to have the conversation when both of you are sober and not under the influence of drugs or alcohol. It's important that you come from a place of love and concern, not judgment. Express your feelings and concerns in a clear and concise way. Don't try to fix the problem or take on the responsibility of their addiction yourself. That's something they need to do themselves. Encourage them to get help from a professional and offer to go with them if they are resistant. Reassure them that you will be there for them through the entire process. If you're not sure how to start the conversation, try saying something like this. I'm worried about you and I want to help. Let's talk about this so we can figure out a plan together. I love you and I'm here for you no matter what. If your loved one is ready to seek help for their addiction, congratulate them and offer your support. Let them know that you will be there for them every step of the way, from treatment to recovery. Continue being positive and supportive throughout this entire process. It will make all the difference in their success. Treatment process. When it comes to addiction treatment, there are many different options to choose from. But the most important part of the treatment process is finding the right program for you or your loved one. Here are some of the most common types of addiction treatment programs. Inpatient treatment. This type of program requires patients to live at the treatment facility for the duration of their treatment. This is often a good option for those who need a structured and supportive environment to recover from addiction. Outpatient treatment. This type of program allows patients to live at home and attend rehab sessions at a designated location a few times per week. Outpatient rehab can be a good option for those who have strong support systems at home and can commit to attending regular treatment sessions. Individual therapy. This type of therapy is conducted one-on-one between a therapist and patient. It can be an effective way to address underlying issues that may be contributing to addiction. Group therapy. This type of therapy involves a group of people who are struggling with similar issues. Group therapy can be a supportive environment where people can share their experiences and offer support to one another. Family therapy. The most important thing to remember is that addiction is a chronic disease, and recovery is a lifelong process. There is no one-size-fits-all solution to addiction, but with the right treatment program and support system, recovery is possible. Strategies for preventing relapse and improving sobriety long-term. Relapse prevention is a critical component of sustained sobriety. There are many different strategies that can be employed to help prevent relapse, and each person's needs will vary. However, there are some general tips that can be useful for most people. One of the most important things you can do is to develop a strong support network. This includes friends and family members who will be there for you when you need them, as well as professionals such as therapists or counselors who can provide guidance and support. It is also important to have healthy coping mechanisms in places, such as exercise, relaxation techniques, or positive self-talk. Finally, it is essential to keep up with your treatment plan and attend all scheduled appointments. If you find yourself struggling, don't be afraid to ask for help. The most important thing is to keep moving forward and never give up on yourself. With time and effort, you can achieve long-term sobriety.